case of a 45-year-old female who had been complaining of a swelling over the dorsal aspect of our foot on the lateral aspect, which is overlying the fifth metatarsal. So this is a T2 weighted sagittal sequences, and as we move from the midline, this is the talus, this is the calcaneum. Now we'll move towards the lateral aspect, and we see that this is the sinus tarsifet, and from this region there is one lobulated multicystic or septated ganglion cyst, which is fluid signal intensity arising from within the sinus tarsi. So this is one of the experienced or one of the commonly discussed pathologies, that sometimes from the sinus tarsi there arises a cyst, and this is maybe the cause of a pain. But in this case of our patient, this is an incidental finding. Now as we move more laterally, this is the fourth metatarsal, and now if we move towards the fifth metatarsal, we see that there is a lobulated similar signal intensity lesion which is intercommunicating and has got septations and is giving a beaded appearance overlying the fifth metatarsal. So we try and see if we find a ganglion cyst which is located in the subcutaneous plane on the dorsal aspect. We try and see first from where it has come. Usually it comes from a joint. In this case, the joint which is which over which this is overlying would be the cuboid and the metatarsal articulation. So we'll try and see that on the T2 weighted coronal images. So as we move from anterior to posterior, we see that this is the lobulated ganglion cyst that I have been talking about, and this has got some internal septations as well. Now this is the joint from which this region is the joint over which we see the start of the ganglion cyst. However, we are not able to see the origin of the cyst. Now, one thing that makes it a unique is that in this region there is no other vascular area from which it can cause compression. However, there is one dorsal cutaneous nerve or a lateral dorsal cutaneous nerve, which is a distal branch of the sural nerve. The sural nerve is seen on the lateral aspect. Now, as we go posteriorly, this is a posterior most cut, and from the lateral aspect we start seeing this tiny vessel which is superficial, and from this region we see few hyper intense linear area which is accompanying this vessel, and this is the course from where we expect the sural nerve to be. So this is the region of the sural nerve, and sural nerve itself supplies the it is a sensory supply to the lateral aspect of the ankle on the dorsum. And now as we move anteriorly, we see that this is the sural nerve, and as it goes anteriorly it gives off two terminal branches. One is the dorsal lateral dorsal cutaneous nerve of the foot, and another is the anastomotic branch. The anastomotic branch goes and it supplies along with the superficial peroneal nerve. So now this is the lateral most region, and we are looking in the region of the dorsal lateral cutaneous nerve of the foot. So this ganglion is seen in the expected location of this nerve, and this tiny ganglion which we are seeing, this can possibly be an intraneural or a perineural type of ganglion. So this is sometimes essential, because this would lead to then compression of this nerve and cause the irritation, and which would lead to paresthesia as well as pain in this region. So this is a diagnosis of a ganglion cyst along the course of the dorsal lateral cutaneous nerve of the foot. Now I'd just like to point out that this is a pure sensory branch, so we are not going to see any kind of denervation changes. Only changes that the patient would experience would be pain, tingling, paresthesia on the lateral aspect on the dorsum of her foot. So this can easily be diagnosed on MRI as well as on the ultrasound, as it is a superficial structure. So this is quite a unique diagnosis. Not many cases are there in the literature, and the treatment of this cases is very simple. It is just aspiration, and with some amount of anesthetic we can inject the anesthetic after we have aspirated the ganglion, so that it won't recur. And On the coronal images, we are also able to see this sinus tarsi, this region very well, and from this we are seeing this originating ganglion. So this is another but just a incidental finding, nothing of significance here. Thank you.